So very encouraging news overnight, and the most encouraging news from my point of view is that 33,000 tests were done, because we can only find cases of transmission in the community if people get tested. So I thank every single one of the people who came forward yesterday and got themselves tested. That has been critical. So we had 3 new cases overnight. One was a case acquired overseas in India and diagnosed in hotel quarantine, so will be admitted to hospital. The other 2 were locally acquired cases related to our second cluster. So I already have the genome sequence back for one of those 2 cases, and is exactly the same as the genome sequences for that second cluster, related to the nurse and her friends who were in that party who went down to Byron Bay. So that's a linked case. We're now working through whether this second nurse in that cluster acquired it on the ward. She does work on that ward, and she was tested as part of the asymptomatic screening testing process for that ward and was found to be positive. She has since developed some symptoms, but she was part of that testing. So we just need to work out how she got it on that ward. She had been vaccinated prior to working that shift. So we're just working through all of that at the moment, but that's very good news. So we now have 11 people in that cluster. Now, the first cluster, remember yesterday I spoke about 2 cases that we're investigating who we thought could be part of that cluster because of the epidemiological links and some initial testing. They've now been confirmed as not positive. They're not cases, which means we now have 8 in that cluster, that first cluster, related to the doctor who acquired the infection at the PA hospital. So those 2 clusters look like that they've all been worked through. All of those cases are linked, and we do not have any other cases out in the community anywhere in Queensland that are unlinked. So we do have some people admitted to hospitals, but they're part of that second cluster. So we do have an individual admitted to the Toowoomba Hospital and another to the Bundaberg Hospital. Both of those hospitals have managed COVID positive cases before, and they are managing those too. And because we got them so quickly due to that very fast action by that first nurse in that second cluster, we're not concerned that there's been any significant risk to the community. Having said that, these viruses are just so contagious. Both clusters are based on the B117 variant, which we know is very, very contagious. So please, anyone in Queensland, as happened yesterday, anyone with any symptoms, come forward and get tested immediately. Don't think it's because you've got kids who've been to childcare and they've had the virus that's circulating in childcare. Ignore any of that. Just if you've got any symptoms, please just come and get tested. And thank you to everyone for your patience in coming forward. This is a big load on the health system, but the health system will manage it and will test everyone who comes forward. That's really, really critical. But this is encouraging news overnight, and it's encouraging because people have come forward and got tested, and also people have followed all of the instructions. Here today, I can see, I think everyone, except us two, with masks on. That is fantastic. We need to continue that throughout the state, remembering that indoors is the most critical place to wear masks. Then going back to the seated drinking and eating so that you don't mingle around. That is so important. Limiting the number of people in a household to 30. That is so important for that area outside of Brisbane that isn't in the lockdown at the moment. Doing those things and protecting our most vulnerable. We've not quite got there yet with the vaccine for our most vulnerable. So that's really being rolled out now. So we do have to protect our disability accommodation, our aged care accommodation, our prisons and our hospitals, because that's where we know our most vulnerable people are. So thank you. No, sorry. Thank you. You're always very good at picking things up. So the first case is a nurse who's acquired it from that gentleman from India at the PA, and I have confirmation of that because I have the genome sequence. They did that very rapidly. Then the second case lives in the same household as that nurse. So it's household transmission, and we know that household transmission is our highest risk at the start of any outbreak. No, it's the second nurse. I don't have a genome sequence yet for that second person, so this is someone who lives in the same household as the second nurse. I don't have their gene, but I'm sure it'll be the same. They're the two overnight cases. Yep, so they are the part of that cluster of 9 that I told people about yesterday related to the man from India. So you have the man from India who was admitted to the PA hospital, right? There's been a transmission event to one nurse there who then went to Byron Bay and had a party in Byron Bay, and all of those people who are at that party, of course, have been tested. There were 10 of them, 6 of them are positive, and of those positives, one has been admitted to Toowoomba Hospital and the other to Bundaberg Hospital.